Welcome, hopefully, to the Harrisburg University hosted MovePA Precon. We'd certainly love to see you there, but we also understand why you might be not entirely sure whether this precon is right for you. So, we'd like to tell you a little bit more about what it's about. I'm Dr. Kate McGee. I'm a faculty member here at Harrisburg University.
I'll go next. I'm Dr. Allison Harris, also faculty member here at Harrisburg University.
And I'm Dr. Jennifer Price, also a faculty member at Harrisburg University.
Right. So our pre-con session probably has the most acronyms in it of any session. It's got VR, it's got AR, it's got AI. What on earth are we talking about?
Well, VR and AR are similar in that they're augmented reality settings. So VR stands for virtual reality, and that's where you're in an immersive experience and you can't really see the world around you. You're in a very digital world, whereas AR is more of a augmented reality that you can see what's around you. You can still see your surroundings, but you're still in that immersive world a little bit. It's a little less intense.
That's a great way to put it.
Yeah, and Allison, how about the AI aspects that we're going to be talking about?
Yeah, so we've started to implement AI a little bit here at Harrisburg University. So, one of the things that we've been doing successfully is building avatars that our students can interact with so that we can have them communicate or conduct histories, for example, by developing these avatars that have this rich background. And we can really kind of, set the scenario up to be like a real life interaction between students and clients.
Right. And of course, we've been using this through an educational lens, and there's probably some PTs considering coming who don't really see how VR, AR, and AI could be applicable to their areas of practice. So, what are some of the ways that these technologies can be used more broadly for more PTs?
I know in the world of pediatrics, there's a lot of research out there, specifically looking at neuromotor impairments, things like cerebral palsy. There's also some research based in chronic pain syndrome and just some general conditioning and things like that, looking at standing balance, looking at standing tolerance, those types of things after long hospitalizations or whatever the situation may be.
And I imagine the gamified aspect is also pretty good for the pediatrics world.
Yes, it's very good for the pediatric world. Kids definitely respond well to a gamified experience, and those immersive worlds too. Lets them escape a little bit. I know, in when I worked in the hospital, we did a lot of things with gaming, and it does allow them to kind of get a break from their reality, which is really nice.
Yeah, and I mean, to be fair, the gaming is not just for the kids. As a neuro
Right.
nerd who works more on the adult side of things, adults love the gamified aspect too, and this is super duper applicable for a lot of our stroke patients, especially since we know we definitely can't get enough hours of rehab into early stroke patients in outpatient. We can barely get enough into them in acute rehab, but if we add in that outside of our time with them experience, if they're taking more steps alone, we know that it's better for them. But if we can add in immersive world components where they're practicing balance skills, where they're doing more dynamic movements, and where it's not just okay, go walk for a while, they're that much more likely to get those extra minutes and hours of rehab in, which we all know leads to a big change. And then, of course, Allison, you and I have also used the AI avatars in particular with some of our students, not only to have them practice, the technical skills, I guess, of PT, but also to practice some of those interprofessional soft skills, the having difficult conversations, the dealing with an angry patient or an angry patient's parents, as in the pediatric case at times, allowing them to do that in a low stakes environment where they're not necessarily at risk of accidentally blurting out, we'll just take it one step at a time to a spinal cord injury patient in real life.
Yeah,
So,
absolutely.
So on
I
the
think we've had
AR
some.
and AI side of things in particular, there's plenty of us, me included, who have concerns about AI potentially diminishing our scope as PTs or taking our jobs. So what can we say to PTs who have a similar fear?
I'll jump in and just say, I think, there's lots of opportunity for efficiency with AI. There are certainly a lot of repetitive tasks that we do as physical therapists. And, Jen and I were talking about this a little bit earlier that we have so much power in those, one-on-one interactions, providing that, personal, touch. And I think just like EMR sort of was heralded as, a nervous change, it did produce some efficiencies. And I think we are going to see that AI does some of the same things for us.
Yeah, and I agree. I think the empathy that we can bring is such a huge thing. We can see how our patients are responding in the moment, and we can, reflect on that. We can be there to support them through things, and we can also just read the situation and see that maybe today's not the best day to push them through things. Maybe we need to back off today so that we can go a little harder the next time. And even just our clinical reasoning, we learn so much clinical reasoning, and it's nice to be able to spend time doing that when we don't have to worry about the repetitive tasks or the data analysis, that we can let a machine take care of that and we can focus on the patient in front of us. And I think that's really important.
And I'll also I'll add a really great analogy that one of our other colleagues, Dr. Chris Condren, proposed, which was that AI is going to keep developing whether we are involved in the process or not. And we've got one of two paths as a profession that we can take. Option number one is kind of go the route of the radiologists, which was basically refuse to have any involvement with the development of AI based radiology reading tools, which has resulted in them largely getting shut out of the conversation. Or we could take the route that the surgeons did when the Da Vinci surgical suite technologies were being developed, which was okay, but we're the experts, so we have to be in the room helping you develop and figure out how to use and implement those. So if we want to be in the room where it happens, then it is up to us to understand this technology. And this particular precon is a great place to get started with understanding some of the ways we can start applying this technology. So, at these lab sessions, because we've got both a lecture and a lab component, what can participants expect to actually do with some of the technology that we have on hand?
One of the things I'm really excited about, especially with this team, is the ability to bring people in at all different levels. So I myself am very much new to some of this technology, but immediately saw how it could solve problems. For instance, in acute care, we often have difficulty kind of, learning more with medically complex patients and keeping our continuing ed up. We saw a real opportunity for simulation. So this is something that immediately I was drawn to, but didn't know much about. And so I think you can come in as someone who really doesn't know much, feel comfortable, and expect to leave with some hands-on experience and some general knowledge. But the team's also so knowledgeable that if you come in already knowing, I'm confident that they're going to be able to meet you where you're at and continue to inspire you and draw out your interest in these areas.
Yeah, I agree. And we have some really cool tools and things that you're going to get to see, like our Toltec anatomy table, tables, there's more than one, that you can really experience anatomy in the human body through a virtual setting. And it's really very, very interesting. And it's a really great way to interact with the material. And you're going to get to see that. So that's going to be really, I think, very beneficial.
Yeah, I think when I first got to take a look at how we can connect those tables with the VR headsets that we had, I described it as being really excited to help my students misfizzle their way through the human body. We can do things like you can put on the headset and direct other students wearing other headsets through the exact same anatomical path that you are looking at. So you can do like we're going to do some guided pathways there. We'll show you some of what we've put together in terms of lessons on the tables that take you through components of the shoulder or components of the nervous system. You'll get a chance to see some of the AI avatars we've been using, both the ones for technical practice and for the interprofessional or soft skills practice as well. So you'll get a chance to test some of these things out. If you are brand new to the world of VR, AR, and AI, don't worry. We'll be right there holding your hand, perhaps literally if needed. And if this is a little bit more familiar to you, we are happy to let you loose a little bit more and let you just explore some of the resources that are available. So, wrapping this up, what is the most important thing that each of us really want our participants to take home with them from this session?
I think confidence in knowing that this is a tool and something that we can use versus something that's going to replace us. I think being comfortable with the technology is really going to open up some really cool things that you might have not considered before, with your patients, and I really hope that's something that you get out of it.
Yeah, I agree. I think, kind of getting over that hurdle, if that's you, the way it was for me. And as an aside, I've been able to impress young people now with some of my acronyms and terminology.
And I really just want to make sure that PTs feel comfortable directing this conversation, because this conversation should not be about what we do without our involvement. And this is a really great place for PTs to get a baseline understanding and then hopefully have a little more openness to learning more about these technologies, whether it's learning more to ensure that we are directing the conversation, or whether it's learning more to figure out how you can apply it to your own patients or your own students. So, with that being said, we really hope that you guys consider
Yeah.
registering for this pre-con. We would love to see you at HU's fantastic new PT
Yep. Come
spaces,
see.
and not
Hmm.
just because we want to show off how cool they are. We'd love to see you
But they're
there,
really
and we
cool.
hope you will join us for our lab and lecture on VR, AR, and AI.